welcome to our special show, Living Long and Healthy with COVID Vaccination. This show seeks to address any concerns that you may have regarding COVID vaccinations and living in this new normal. Because do remember, the risk of COVID infections continues even as cases are rising, and the vaccination is the only way that you can protect yourself. Today we have with us experts to address any concerns and questions you may have. Joining us on the show today, Dr. V. Ashwin Karuppan, a consultant physician and diabetologist, Gleneagles Global Health City, Chennai, and Dr. Sheetal Kumar Hiran, interventional cardiologist, Healthy Heart Clinic, Nasik. Thank you, doctors, for joining us on the show today. Dr. Karuppan, I'd like to start with you. And currently in India, we have two vaccines that are available, Covishield and Covaxin. And one of the questions that we get very often is, what are the differences between these two vaccines?
See, as you said, currently Covishield and Covaxin both have been widely distributed and are the only vaccines which are available in India. Whereas when you come to Covishield, it's a recombinant vaccine where it is based on a vector technology from the use of a chimpanzee adenovirus. Whereas when you come to Covaxin, it's a whole inactivated COVID-19 vaccine which is developed by the strains of novel coronavirus, and especially from the dead virus where it has no possibility of infecting others. It can just only improve your immunity status towards it. Both of them have an efficacy around 75% to 80% and have been proven to be very effective in phase 3 trials and currently in use. Both these vaccines can be given only above 18 years of age group, and then pregnancy, lactating mothers, immunocompromised, or anybody who have a bleeding disorder cannot take this particular vaccines. So that is the difference between both. And one is a vector based and another one is actually a dead virus protein which is injected into your body. Both are completely safe and effective.
All right, and hopefully soon we'll have more vaccines in our kitty. Dr. Hiran, it's just been a few months since the vaccination drive has begun, and there's still so much we need to know. But is there any clarity yet as to how long the vaccine protection lasts? And also, when does the vaccine actually start providing effective protection against the virus?
As you said, these vaccines have been just developed few months back. Majority of patients who have suffered a COVID infection, these people have shown that the immunity is developed and chances of getting reinfections are less in those patients. But time only will tell us that how much the efficacy of vaccine and how long they will provide the effectiveness is time only will tell us. And the second part, what you said, that how long the vaccine takes to develop the immunity. So when you take the first dose of vaccine, after 2 weeks time, the immunity is developed in range of 50%. And when you take the second dose of vaccine, after 2 weeks time, the immunity is developed in the range of 70 to 95% of patients. So the hitch here is that even after taking second dose, 2 weeks are required to develop a better immunity. And till that time, we really need to follow the norms of social distancing, wearing a mask, sanitizing the hands, and washing hands frequently. So this needs to be remembered, and people need to be aware of this fact to take care of ourselves.
All right, Dr. Karuppan, now when we talk about people getting vaccinated, we're told they still have to follow all the COVID protocols, and we were just talking about that. But also, can they transmit the COVID virus post the vaccination, even if they themselves are protected against infection?
Yes, definitely they can transmit the COVID virus. We all know that by taking the vaccine, we actually can prevent the disease and the severity of disease, how it is going to affect us. But it is not going to give us an protection against or an immunity against, infection. So we are protected against the disease. We are not protected against infection. And still, there are many people around. India is a country where 120 crore people are there, and it is impossible for everyone to get vaccinated. So when you get vaccinated, there are people surrounding you who haven't been vaccinated. So you have a social responsibility of protecting yourself and others surrounding you. So until then, we find a solution of how we can go about a complete cure and control of this coronavirus. Social distancing, wearing a mask, washing your hands needs to be followed at all point of time. Even if you are vaccinated, you are still eligible to transmit this infection from one person to other, and you can also get infected with this. But the infection might not be as severe as the people who haven't been taking vaccination.
Right, and that's how we know the vaccines are indeed working. Now, Dr. Hiran, so far people over 45 years of age are allowed to get the vaccine, and many of them, are on medication. AC inhibitors were earlier supposed to be a part of the virus pathway. So are people who are on AC inhibitors or hypertension medication, can they safely go ahead and get the vaccine?
Yes, initially there was a concern that the ACE inhibitor drugs or the ARB drugs, they are involved in the virus pathways, and that causes increased infection or increased susceptibility to the disease. But after consensus of many scientific societies, after consensus of expert group of cardiologists, it is now clear that these drugs are very safe and they don't cause any interference in increasing the disease susceptibility or severity of the disease. ACE inhibitors or ARBs, these are the drugs which are commonly used for hypertension, the patients with low ejection fraction, that is when the pumping of the heart is low, these drugs are found to be very effective and we are supposed to take these drugs regularly. Suppose the patient misses those drugs, then chances of getting complications of the heart diseases are more. So I would urge people who are taking drugs like ACE inhibitors, for example, ramipril or enalapril or ARBs like telmisartan, losartan. These drugs are very safe. You should continue those drugs. You should not stop them. And there is no interaction of these drugs with the COVID disease. So it's very safe now.
Right, and so that is people, with these hypertension, etc. Let's talk about people with diabetes. And Dr. Karuppan, can a person with diabetes or thyroid disorders safely take the vaccine? Does it have any effect on the blood glucose levels?
See, for the thyroid disorder, there hasn't been any kind of contradiction of taking any vaccine so far. But when you come to diabetes patients, they are the high-risk individuals who are supposed to be given the vaccination. Even in the comorbid list of people who need to take vaccine above 45 years of age, the first thing is listed is diabetic patients who have prone and who can become extremely sick. So they are the ones who needs to take the vaccination at the most. Usually these vaccines do not produce any kind of side effects or do not increase your sugars to any extent. But after the vaccination, there are chances that you can get fever and there might be some amount of fluctuations of blood sugar, but that is absolutely normal. And once this fever subsides in 1 or 2 days, the vaccine is going to take effect and it's going to be settling down the blood sugars as well. Apart from which, people who have high blood sugar, when they take vaccination, there are chances that the immune system might not function as great and the vaccine efficacy can be lowered. So it is always better to have an adequate sugar control before you take vaccination. But there are no contraindication which says that high sugar patients cannot take vaccination, and it is recommended for all the people, especially diabetic patients of any age, to get themselves vaccinated to prevent a more severe form of COVID disease.
All right. And, another question that we get very often, especially since, again, it's, the elderly who are getting vaccinated right now, is about blood thinners. And that's the question they keep asking. Dr. Hiran, so are those people who are on blood thinner therapy or antiplatelets eligible for the vaccination? Is there anything they need to keep in mind? Do they have to, modify their medication before they take the vaccine?
This is really a very good question because every day we get at least 10 to 15 patients in our OPD asking the same question. The answer to this would be there are two type of drugs what a heart patient takes. One is antiplatelet agent and second is anticoagulant drugs. So the antiplatelet agents, these are the drugs in the form of patients taking aspirin, taking clopidogrel, prasugrel or ticagrelor. These are the drugs which are usually prescribed for the heart patient, the patient who has gone recent angioplasty or bypass surgery, or a patient who has suffered a brain stroke. So these are the blood thinner medicines which really needs to be taken daily, and if we miss these doses, there are very high chance of getting a recurrent heart attack or a brain stroke or worsening heart condition. There is no contraindication. That means that these drugs can be taken daily and vaccine also can be taken. There is no need to stop these drugs, and there are no side effects seen in general with these drugs. So the antiplatelet agent in the form of aspirin, clopidogrel have to be taken daily without interruption, and you can safely take the vaccine. The second part is anticoagulant. Many are patients who have undergone heart valve surgeries, who have implanted prosthetic heart valves, the patient who have suffered a pulmonary embolism like blood clot in the lung artery, or there is a blood clot in the lower limbs or upper limb, and these are the patients where anticoagulants in the form of acetrom or warfarin, these are taken. This causes thinning of your blood, and your blood is thinner by 2 to 3 times than a normal range. So these patients need to take some extra precaution. So I'll repeat, the patients who are taking acetrom or warfarin, they should consult a doctor before taking the vaccine. If the INR range is in the therapeutic range, that is up to 3, you can still safely take vaccine. If the INR is more than 3, you really need to consult the doctor. And suppose if something goes wrong, like inadvertently patient has taken vaccine, still you don't really need to worry, because after taking the vaccine, just give pressure, but don't rub the site where you have taken injection. Give pressures of 5 to 10 minutes time, if required cold fomentation, and usually we observe for 30 minutes. That is the main reason, to observe the patient after taking vaccine for 30 minutes. If he is developing some complication, many a times patient doesn't develop any complication, and if it is there, that can be rectified immediately. So these are the precautions what we really need to follow and take the vaccine very safely.
All right. Well, I hope that clears any doubt that people had. Time for us to slip into a short break, but we'll be back and to answer more questions that you may have about the entire vaccination process. Welcome back. You're watching our special show, Living Long and Healthy, with COVID vaccination. And we have doctors taking all your questions. Dr. Karuppan, are there any special instructions for people who have severe diabetes? Anything they need to look out for? You do have that half hour there, and a very important point made by Dr. Hiran to, follow all sorts of COVID protocols when you go to the vaccine center, because you don't want to get COVID there. But tell us about people with severe diabetes. Any special, instructions for them?
See, COVID-19 is basically a severe disease and can turn deadly for diabetic patients. And most of the patients who are affected in China and throughout the world, more than 50% of these patients are COVID-19 patients are diabetic, and they have uncontrolled sugars. There are many data which suggest that if you have uncontrolled sugars, you can fall really ill. The second point is, like the treatment for COVID-19 itself is a lot of steroids which is being given, and that can also increase your blood sugars. So I would suggest all the diabetic patients to keep their sugars under control. And during the lockdown, because of lack of exercise, a lot of stress and a lot of news which are coming in actually increases your blood sugar, and you need to keep in touch with your doctor regularly for your blood sugar controls. And importantly, if you are ill, or if you have developed a fever, cough or cold, or any signs of COVID related symptoms, or for that any acute illness, do not stop your medications because your intake is lower. Instead of that, check your blood sugars more frequently at home, where it is available as a self-glucose monitoring, and continue to monitor your sugars and continue the medications, because controlling your blood sugar can save life, can decrease the severity of the disease, and can help you in recover faster. So all diabetic patients needs to be following strict protocols of wearing a mask, following the social distancing, washing your hands regularly, and avoiding public places where and when it is required until we get a complete cure about this COVID-19 disease.
That's right. And if you're eligible, go ahead and get vaccinated. Dr. Hiran, is the vaccination safe for people who've undergone procedures such as heart surgery, stenting, valve replacement procedures? Should they go ahead and get the vaccine?
Yes, the patients who have undergone heart surgeries and those who are taking aspirin, clopidogrel, they should be taking the vaccine without any doubt in the mind that they would develop some complications. But the key point is, the patients who are taking drugs like acetrom and warfarin, if the INR is more than 3, then they should consult the cardiologist or cardiac surgeon, get the INR in the therapeutic range, and get vaccinated safely. Because if the INR is more and the blood is more thin, 3 times or more than that, then the chances of developing some kind of hematoma or some other complications would be more. So these patients really need to take precautions, consult a doctor, and then take the vaccine. But patients taking with aspirin, clopidogrel, who have undergone angioplasty, they can safely take this drug and take the vaccine. There is no need to stop these drugs.
All right. And Dr. Karuppan, any special care for people with diabetes complications like kidney impairment and diabetes foot disease?
Diabetes itself is a bigger picture to look at the comorbidities who really need to get vaccinated. And there is absolutely no contraindications for people who have diabetic kidney disease who undergo dialysis. As Dr. Kiran has already mentioned, that no contraindications for people who have had a stunt or a cardiac disease along with diabetes. So absolutely no contraindications for people, and they should get vaccinated as quick as possible, because there are many mutants and variants which are actually already coming out. And I think the best way to prevent these diseases is to get vaccinated as quick as possible and be safe at home.
Right. And Dr. Hiran, finally, the last year, 2020, much of it was under lockdown, much of it was in fear of coronavirus, and a lot of people who required certain surgeries, procedures, especially heart patients, put off those elective surgeries and these operations. So what is your advice to them? Should they now go ahead and get the operations done?
Yes, definitely. Because now COVID is going to be a part of new normal life. We have to accept that. And many a times we fear that we try to postpone our surgeries. We try to take remedies at home. And we are seeing many complications, including death in heart patients, because they are reluctant to take the treatment. So I would request people, please don't underestimate your heart disease or heart element. Consult your doctor. Hospitals have been following good protocols. They are separating the COVID patients and non-COVID patients in the form of green zone and red zone, where in the green zone they can safely take effective treatment for heart disease, for the brain disease, and patients are undergoing elective surgeries in the form of angioplasties, bypass surgeries in a very safe way, because we are taking similar good protocols, following these good protocols, so that patients will not develop COVID infection because of others. That is the way we have to live, and we need to take care of our heart, our brain, and rest of our body, and don't be fearful about COVID, because it's going to be part and parcel of our life. So these are the ways where we can take care of our heart elements.
Right, and we have to learn to live long and healthy with COVID, around us, and go ahead and take that vaccination if you are eligible. Thank you so much, doctors, for taking out time and answering all those questions for us. And thank you all for watching at home. That's all the time we have. Time for us to slip into a short break. Goodbye.